Kolkata, and we'll be discussing about this lingering winter that we have and how to take care of ourselves. So thank you so much for sparing your precious time with our audience here. And we might have questions during the session. We'll try and get them answered by you as well.
Sure.
So, sorry, Oz.
Thanks a lot. I think this time winter has gone a bit more than what we expect or normally see. And recently we have seen sudden change in the temperature again, and it has gone more warmer than more cooler. So winter is always challenging for people with underlying respiratory diseases, and those who even hasn't got respiratory diseases. It is quite challenging because it puts people more prone to infections and exacerbations of the respiratory symptoms. So there are a number of reasons which leads to these things, and if you want to go ahead, and I can share my experience or my knowledge about it.
So we have a question though. The question is, why do cold temperatures make it harder to breathe?
What happens with the cold exposure to cold? Our airway smooth muscles go into spasm, and what we call bronchospasm, just like we all feel uh, just to shrink, and the same thing happens to our airway smooth muscles as well, and the airway gets narrower, and that makes us or anyone, particularly people who have underlying respiratory diseases, more wheezy and breathless, and it also puts people more prone to infections and other things.
So people ask that which is worse for people with lung disease? Is it the bitter cold or the heavy heat?
This is a very interesting question because I don't think there's any study done on these things, and this is very individual. Extremes of either of these two things are particularly detrimental, and they can cause increase the symptoms. Some people feel worse in winter. Some people feel worse with the cold or with the hot temperature, and I think this way it is related. Either it's a drying of the what we call airways surface layer of the fluid, or whether it is bronchospasm, which can trigger this. These couple of things can trigger the symptoms from the people with airway diseases.
So why is the change in weather leading to increase in respiratory problems? We've seen that for quite a few people.
We can postulate it due to number of hypotheses, and as I said, if we go from uh, normal weather to cold weather, it can increase the bronchospasm, increase the symptoms. It can also change the atmosphere, the indoor and outdoor air quality, the content of the air, exposure to some of the infections are more common during winter, like flu and common cold viruses, and they put people more prone to infections and exacerbations of respiratory symptoms. And I have to say that it is not the infection only; it is the quality of air, the pollutants, having closed door without any fresh ventilation can all predispose and all contribute to these symptoms.
Is there any specific measures that people with lung disease should take to stay healthy during winter?
I think first of all, I would say that people who have underlying lung disease, they should maintain their medications very regularly. They should take their medications. They should take prophylactic medications as well. And people who have underlying lung diseases, if they they get symptoms during exacerbations during winter or exacerbations during winter, immunization does help, particularly with the flu vaccinations on the yearly basis and pneumonia vaccination, which can be given from every 5 to 10 years or even once in a lifetime.
So, as we recently heard that there are uh, among the top 14 cities, polluted cities in the world, India has 10 of them. So, there is pollution, there is lingering winter that is not willing to go, and we are hearing that winter is going to come back again with in a short phase. So, what do people do when there is pollution and there is this winter which does not let the pollution go that easily? So how do people take care of their breathing problems?
I will also that probably the better answer for this question are in two different lines. One is on the bigger picture to control the pollution itself, and on the individual basis to maintain or to maintain your own health and look after yourself. There has been lots of move from organization, from government organization, non-governmental organization to contain the pollution in the environment. And I've seen there has been so many discussion and so many awareness has been made in the media, in the social media about the pollutions. And this is what we see is it on a global picture or on a bigger picture. On the individual basis, I would say that keeping well hydrated, maintaining the keeping the medications, maintaining their regular medications, taking them regularly, and not getting exposed or preventing coming in contact with someone who is unwell always helps in these scenarios.
So, is there a possibility that during winter people with asthma they face more difficulties breathing than during summers?
Yes, I think there has been reasonable evidence that asthma can get worse during winter, and particularly if you see extremes of weather, it can make asthma clearly worse. The underlying problem in people with asthma is bronchospasm. That means airway smooth muscles gets contracted and airway gets narrowed. And exposure to cold air can precipitate or exacerbate. Though our body has a very good defense mechanism to heat up the inhaled air through the sinuses, through our nasal passages, but they might not be adequate all the time, and it can lead to increased dryness as well as predisposition to irritant, which is in the environment, and bronchospasm and increased symptoms of asthma.
Is there a role of sinus? People with sinus, do they have difficulty in breathing during winter as well?
We can see that there are exposure to environmental temperature change in the irritant in the environment. Cold, during cold wind season, people try to stay indoor, and more people stay indoor, and there is a change in the quality of air, as well as more non-allergic as well as allergic rhinitis symptoms come in, and they definitely contribute both to the upper airway symptoms as well as lower airway symptoms. And people with allergic rhinitis or non-allergic rhinitis or sinus problem, they get more symptoms. This contributes to what we call trickling down effect and more lower respiratory tract symptoms as well.
So the last question that we have for the time now is how do people with lung disease or any other uh, breathing disease prevent the breathing problems during cold weather?
That's a $1 million question, because we know that there's a rapid surge in the healthcare demand during winter, particularly for the people with respiratory illnesses. Some of them we can try to do or try our best to prevent. And as I suggested, is trying to stay healthy, not getting in touch with someone who is not well, so, staying more indoors or in fresh air in the ventilated area, um, having regular medications, taking preventive vaccination like flu vaccinations, and uh, and taking medications regularly. All these measures will definitely help.
Thank you, Dr. Agarwal, for sharing your thoughts and answering our questions here. We would love to see you live again. And in the meanwhile, if we get further questions, we'll definitely get you to answer them for our viewers here. And thanks a lot for your time. Thank you, friends, for watching us live.
Thank you.